Today, we're proud to celebrate not only our Leadership Award recipients, but also, for the first time, the boards of pharmacy that successfully updated their licensing and credentialing application as part of the Dr. Lorna Breen Heroes Foundation WellBeing First Champion Challenge. This recognition highlights the vital role boards play in promoting pharmacist well-being across the country. To tell us more and introduce the boards being honored, please join me in welcoming Stephanie Simmons from the foundation. Steph.
I'm so excited to be here today to honor the first Champions Challenge Pharmacy Boards. So I'm going to tell you a little bit about the why behind this award, and also encourage you, if you are not called to the stage today, to consider going through this process and doing this work for your state. On April 26, 2020, we lost Lorna Breen to suicide. She was an emergency medicine physician who was serving patients in New York. She was called back from her vacation to care for patients in the first wave, and I think we all have a memory of what New York City looked like in those weeks and months. She cared for patients, ultimately contracted COVID, came back 24 hours after her fever broke, like so many healthcare workers did, and became emotionally, intellectually, and physically exhausted. She received mental health care and was so burdened by the concern that she would lose her state license, that she would lose her hospital credentialing, and that she would lose the respect of her colleagues, and she shared with her family before she died that that was her biggest concern. Since then, dozens, hundreds, and ultimately thousands of healthcare workers, doctors, nurses, pharmacists, dentists, have reached out to the foundation started in Lorna's name to express that their fear of losing their license is the biggest reason why they don't seek mental health care, which can lead to impairment and patient harm. So by asking about a history of diagnosis and treatment, as opposed to current impairment, we are potentially causing patient harm, and we are certainly causing harm to our healthcare workforce. So the Champions Challenge is that we ask boards to revise their questions to ask about current impairment only, and not about lifetime diagnosis or treatment, so that healthcare workers can confidently receive the care that they need for their mental health conditions, keeping both themselves and their patients safer. So without further ado, I would like to welcome to the stage for the Champions Challenge Awards our first pharmacy boards. And we have 7 pharmacy boards to recognize today, which positively benefit nearly 126,000 pharmacy professionals. This is what the badge looks like, and I also want you to know that on our website, there's a map of the country. And so we will be filling in the states that we will name here as the states that have successfully made this change. Over 35 state medical boards have made the change, and the nursing and dentistry boards are also engaged in this challenge. So as you're thinking about when to engage with this challenge, take a look at what other boards in your state may have also engaged. And so I'd like to start alphabetically with the Alaska Board of Pharmacy. I would like to welcome the Idaho State Board of Pharmacy. The Kansas State Board of Pharmacy. The Maryland Board of Pharmacy. The New Hampshire Board of Pharmacy. The North Dakota Board of Pharmacy. The Ohio Board of Pharmacy. Thank you to all of the boards of pharmacy who have made this important change. I'm going to ask that you stand up here for just a moment as we complete the presentation, and then we'll get a group photo all together. So now that you've made the change, I encourage you to communicate to the pharmacists and the pharmacy professionals in your state who are impacted that they now are safer to receive care. Because we know that communicating the positive questions is the most important point. If a tree falls in the woods and doesn't make a sound, then pharmacists don't get mental health care. And so it's very important to communicate as we go through this process. For those of you who are not on this stage, I encourage you to become a WellBeing First Champion. If you think your questions are good, that's great. Please let us verify those questions and help you communicate to the pharmacists in your state and across the country, and to be recognized in May and September.
All right, thank you so much, Steph. We're off to a great start in this challenge, and I look forward to more boards becoming WellBeing First Champions.